So I have this 45-year-old male that came into our clinic with elevated cholesterol. I'm going to show you guys the comprehensive labs we did with him, but he was frustrated with his primary doctor because he had no plan of action to explain to him why his cholesterol is elevated, and his only option was, here, take these statins and be on your way. This patient, he knew his cholesterol was there to support him. He knew there was some inflammation that needed to be addressed, and it wasn't there to harm him, it was there to support him. So make sure your doctor's doing this type of comprehensive testing for you, especially if all they did was check that LDL and it was elevated and just gave you something to lower it further. So this is where we start with an advanced cardiometabolic panel. As we can see, his LDL cholesterol is slightly elevated, but as you can see, his inflammatory markers like CRP are very low. His oxidized cholesterol, which is the true driver of atherosclerosis, heart disease, and strokes, Lp(a), apolipoprotein B, are very low, meaning he has a minimal risk for cardiovascular disease, further heart attacks. Now, his homocysteine level is elevated, which indicates he's not medication deficient, he's just severely B vitamin deficient from his diet, and we'll consider here supplementation, obviously. We also uncovered that this patient's vitamin D was very low, which should always be tested with cholesterol, because remember, when this gets too low, it's an immune system stress where the liver will make more cholesterol. And we finally sat down and uncovered which 10 foods he was responding to, which was causing inflammation, not only to his immune system, but obviously even to his liver, to produce more of that cholesterol, which his doctors prior weren't even talking to him about his nutrition. So the moral of the story is, make sure your doctor is sitting down with you doing comprehensive cardiometabolic panels here to really address, is there actually risk for cardiovascular disease, or do you just need to clean up your diet, find what's causing some inflammation, find those deficiencies to further support you. He was not medication deficient, he just needed to address the inflammation to his liver. If your doctor won't run a panel like this for you, message us to contact with us. Once again, we work with patients all over, virtually over phone consultations as well, if you need that further guidance.